So, what I'm going to talk about is the benefits of utilizing the services provided by an athletic trainer in the workplace. First, I'm going to begin by explaining what is an athletic trainer. Um, then, we'll talk about the injury prevalence level in the workforce. Moving on to what the cost of workman's comp looks like, the cost of work hardening and reconditioning, uh, the cost of employee wellness programs, and then how an athletic trainer potentially could help your company, and then also what the ROI looks like on investing in the use of an athletic trainer. First, what is an athletic trainer? An athletic trainer is a highly trained and educated allied healthcare professional specialized in the prevention, assessment, treatment, and rehabilitation of injuries and illnesses. Athletic trainers are trained in the following specific areas: evidence based practice, prevention and health promotion, clinical examination and diagnosis, acute care of injury and illness, therapeutic interventions, psychosocial strategies and referral, healthcare administration, professional development and responsibility. Injury prevalence in the workforce. A study done by the National Athletic Training Association in 2014 shows that 40% of total injuries in the workplace are strains and tears. 29% of total injuries in the workplace are some sort of other musculoskeletal disorder. So that's 69% of workplace injuries that are simple sprains, strains, tears, or musculoskeletal. With these injuries, it's causing missed work time. Carpal tunnel syndrome accounts for an average of 27 days of missed work. Simple tendonitis, 14. Musculoskeletal disorders, 11. Sprains, strains, and tears, 10 days of missed work. And just for simple back pain, 8 days. It's estimated that work-related musculoskeletal issues account for more than 600,000 injuries in the U.S. workforce. That's going to translate into a loss of 34% of all workdays. Workman's comp can be quite costly. The National Academy of Social Insurance reported in 2012 that workers' comp costs employees from 75 cents in Texas to $2.74 in Alaska per every $100 in employee wages. The U.S. Department of Labor Statistics reported in 2014 companies experience varying monetary loss depending on employees' responsibility. If the employee's responsibility was sales or professional, the loss was about 22 cents per hour per employee. If the employee was managerial or professional work, the loss was 32 cents per hour per employee. If the employee's responsibility was production, transportation, or material moving, such as packing, shipping, lifting, anything in that nature, it was 79 cents per hour per employee. And if they were natural resources, construction, or maintenance, it was $1.07 per hour per employee. Workman's comp presents its cost usually in the initial evaluation by a physician. And if it's the case, if it's musculoskeletal, oftentimes it may not require any outside intervention. It can be evaluated by an athletic trainer. But then most of the cost for workman's comp comes from rehab at an outpatient clinic. This average visit is going to cost between $100 to $200. Most rehabs are going to occur over a 6 to 8 week period, occurring 2 to 3 times per week. And this number is going to increase for a more serious injury. There are other factors that are going to increase the cost of the injury. Let's say the patient elects to stop therapy. It's too hard to get to. If they go to therapy, they're missing work. There are numerous factors that could influence that. The therapy may be ineffective, or it may not be designed to return the employee to their previous level of performance. So even if they are better, they may not get back to their same level of productivity that they were at before. Also, with these, we're dealing with prescription medications. If the employee is in pain for an extended period of time and they're not getting better, we're going to continue to buy more prescription medications, and that's going to drive costs up. It's also going to cost the opportunity cost of missed work hours for that employee. Also, the cost of training and hiring a replacement for an injured employee. If it's a key role, we often may have to have somebody come in and fill in for that person. And also we have to look in the decreased productivity of an injured employee that returns to work. They may be better, but they may not be necessarily ready to return. So their numbers and their productivity logs aren't going to be as lucrative as they were before. Next, we move on to the cost of work hardening and reconditioning program. Typically, the return to work post injury, that time has the greatest chance of re-injury. Because during injury, the worker becomes deconditioned and endurance capacity quickly reduces. If we can gradually increase the worker's workload and doing work-specific training, the employee is going to reduce their chance for re-injury, they're going to return to their previous level of productivity, and morale is going to improve as well. The problem is, a work hardening reconditioning program, while they're valuable, they can be very costly. Initial evaluation is going to take place over 6 hours typically, and it's going to cost around $125 per hour. The actual reconditioning sessions are going to cost almost $150 for the first 2 hours, and then $75 for each additional hour after that. These programs are going to typically last about 8 weeks, and they're going to be seen 4 to 8 hours per day and 3 to 5 times per week. It can be easily seen how this could be costly. And also, many workers' comp insurance policies do not cover work hardening or reconditioning. So if it's something that you, as an employer, are investing in, oftentimes you're paying that directly out of your pocket. So how can an athletic trainer help your company? Well, first of all, return to work. Athletic trainers have the knowledge and skill to create and implement return to work protocols. They can also modify an employee's current work duty to help decrease time lost and maintain productivity. Athletic trainers can eliminate the price of out-of-patient rehab. They can provide the rehab services at the work site. If it's at the work site, the worker is also more likely to attend. If the source of the patient's pain is addressed, the need for costly prescription drugs is diminished. And this also ensures that the appropriate rehab is conducted that's going to return them to their previous level of performance. Because athletic trainers are skilled at identifying and establishing work-specific body movements and the physical qualifications that are necessary for the worker to perform their job function. We've also can eliminate the cost of many initial evaluations. If it's a non-severe injury, the athletic trainer can evaluate and treat, and the rehab process can begin immediately. Athletic trainers can also introduce injury prevention programs. Athletic trainers are able to work to identify ergonomic risk factors and then recommend and implement controls. They can also develop work-specific physical readiness and conditioning programs for individuals and departments. They're also capable of managing and implementing company wellness programs. Harvard University found that medical costs fall by $3.27 for every dollar spent on wellness programs, and absenteeism costs fall by about $2.73 for every dollar spent. Athletic trainers are also skilled in educating labor forces about health, wellness, and safe work habits. Also, they're skilled in case management. So, athletic trainer can provide ongoing communication between the employer, the physician, insurance company, and employees. Athletic trainers can support the injured employee's progress, monitor medical care, and promote efficient reporting and investigation. So, if it is something that needs to be sent out for further evaluation and intervention, the athletic trainer can kind of expedite that process. Athletic trainers can also assist in finding modified work duty for the injured employee. So what does our return on investment look like? Companies were surveyed by the National Athletic Training Association about their experience utilizing athletic trainers, and this is what they reported. 100% reported a favorable ROI. 30% indicated ROI was at least $7 per employee for every $1 invested. 83% indicated ROI was more than $3 per employee for every $1 invested. 94% indicated severity of injuries decreased by 25%. 68% indicated a decrease of restricted workdays and workers' comp claims by 25%. 50% reported the number of injuries decreased by 50%. 40% of the companies that provided on-site rehab indicated a decrease in healthcare costs by 50%. I'd like to thank you for your time, and if you feel that your worksite could use an athletic trainer, please use the link below to contact us, and we will get back to you as soon as possible. Thank you.